the presentation on plantar fasciitis. And first, to know what the plantar fascia is, that little band, that ligament that starts at your calcaneus and ends at the metatarsal bones. Think about a bow. The arch in the bow is your foot. All those bones are being made into an arch by that strand. And what it does is it supports that arch and it can help direct all those little bones to absorb shock when you're walking or running. So plantar fasciitis occurs when there's overuse of that fascia causing inflammation. So tight calves are often looked at when this is happening because of the pull that it would have on the Achilles tendon from the superior part of the calcaneus to add stress onto the ligament. So you know you have it if there's some sharp pain in the heel, so where the beginning of the fascia starts, and especially when you're walking and running, there's going to be some pain in the heel when you have plantar fasciitis. When you first step out of bed, you know you have it when you have that sharp pain from putting some weight onto your foot. If it's intense enough, there could be some swelling into the foot. Most or all sports that have running are susceptible to this. The more repetitive, the more possible. In our clinic, we've seen a football player that has or is suspected to have plantar fasciitis because he has pain in his foot, in his heel. So when you feel that sharp pain at first, ice and rest is recommended. If it's really bad, anti-inflammatories to help relieve some of that pain and swelling. And massaging would be good to try to loosen up the tight structure and just cause some relief. And the more invasive ways to treat this are shockwave therapy, steroid injection, and plasma therapy. Shockwave therapy has been found to relieve some pain and provide some more laxity in the region. Corticosteroids are to lessen the inflammation in the area, and plasma therapy is to promote healing in the area by taking blood from themselves and extracting the platelets and injecting them into the region to heal tissue that way. In the physical therapy sense, we'd start by making sure there's no tightnesses in the surrounding areas. So the gastrocsoleus complex is going to be stretched first, since it has that tie-in from pulling from the top and stretching the heel at the bottom. And we would see how their footwear affects the way they walk, how they're running. If they're a heel striker, they're more likely to have irritation in that heel section because of the stretch. So if they're hitting with their heel, their toes are also up. That's already in the stretch position. So if they're constantly doing that, could lead to irritating that fascia. Then we would look at how their arch muscles or their support is, their stability in that foot. So we'd try giving arch support exercises such as towel scrunches. That's a really easy way to kind of get the toes to go in, make that arch. And more advanced techniques or exercises to provide would be single leg RDLs, shown in that picture right there with the purple background. To make it harder, we could put a band under the first metatarsal to really emphasize that squeeze and building their arch in an pretty unstable movement. Taping is another option. I've seen this used to get players back on the field. Kind of acts like a little support to put the fascia back into a neutral where it's not too tight, but you can still use it. And in our setting, our football player, we have taped him, and he did find relief in the moment when before he left, and he said it did help when he went to practice that day, but in his follow-up appointment, it was still hurting. And sorry to skip over that part, but what we did was support his arch by preventing pronation, so pulling his foot in the other direction to put some more slack into his fascia to allow more movement and no pain. So as I said, that tape job that our football player experienced was temporary, as along with the other treatments, they are mostly temporary. There was a study done where taping was combined with electroshock therapy actually, and it was found to be effective, but for a short time. And obviously, it didn't really change their biomechanics because tape isn't going to be on you forever. So, in terms of tape, I would think that would be encompassing of most of the treatments here, besides addressing your biomechanics. Um, Checking your footwear. So I'd recommend going to as much methods as possible before going invasive. Go to a podiatrist and see what how your walk is and how your foot acts to your surroundings, and try to address what you can do with that sole wise, in the PT sense, exercise wise, to strengthen any deficits. And being stretching often can help prevent this in general. More people could stretch often. I see we have a more sedentary lifestyle overall since because of COVID as well. And anyone can stretch at any time, and it's relatively easy to stretch your calf muscle. So that'd be a good place to start.